Go.
Yeah. Nervousness, lack in self-confidence, uncertainty, dread. Feelings felt before, during, or after encounters with other people. Social anxiety, the stage fright of everyday life. When do we feel it? What are the characteristics, and how can it be treated? My name is McKenna Owens, and you will soon find out. So, social anxiety is a kind of a thing that almost everybody typically goes through. People like to assume that social anxiety and normal anxiety are the same thing, but actually they are very different. So you could feel social anxiety during a first date or job interview or giving a speech in front of a group of an audience. It's like the feeling of butterflies in your stomach that you get. And I bet almost everyone in here has had that feeling at least once giving a speech in this class. Between 11% and 37%, depending on the certain study, of college students report feeling nervous while interacting with people specifically of the opposite sex. And at least 20% report an excessively high degree of apprehension about public speaking. Higher social anxiety was found with higher negative effect and was not associated with increased time alone. Furthermore, greater social anxiety was associated with greater self-consciousness and preference to be alone while interacting with unfamiliar people. So it makes sense that you would be, if you're in a social situation where you would be scared if you were to come up towards a poisonous animal or if you're driving straight towards a tornado. But what's weird is that people can get severe anxiety by friendly faces. At least 20% are scared of people just standing in a group and talking. Like, they all look so happy. There shouldn't be anything scary about that. So there are a lot of characteristics or symptoms of social anxiety that differ from just typical anxiety. The main one is that with social anxiety, you have a fear of that social situation due to the fear that embarrassment or rejection is going to occur. This can cause people, like the next point, to have a fear of eating or drinking in front of others, which could then cause them to not want to go eat by themselves. They do not like interacting with unfamiliar people or strangers. And everyday tasks are a lot harder for people with social anxiety because they'll do things like avoid going to a store by themselves or returning something to a store. They will not enter a room if people are already present, and they won't even use public restrooms because of the fear. So you realize that their fears are greatly exaggerated, but the person feels powerless to do anything about it. Another thing is stage fright, being nervous to talk to someone that you don't know. And they just usually tend to avoid the social situation at any cost, like making up fake plans or a lie to escape it. Another example is somebody not wanting to raise their hand in class. This could be due to, say you raise your hand and you answer and you're wrong. They have the fear of now they're embarrassed, they've made fun of themselves for the whole class. Everyone might think they're not smart, and it would cause them to just not want to raise their hand in general. And then they also usually feel shyness, introversion, and depression, and obviously anxiety. This tends to affect children to be socially withdrawn later in their life as well. And if you have social anxiety, it can lead to farther things like suicidal thoughts, poor social skills, low self-esteem, trouble being assertive, low academic and employment achievement, an increase in substance abuse like drinking too much alcohol, and hypersensitivity to criticism. So there's a lot of treatment options. We're just going to focus on the behavioral aspect. And there is exposure, applied relaxation, social skills training, safety behaviors, and medications. So exposure is getting the person in the feared situation. So if you are scared of public speaking, one of the only ways you're going to get over it is to go out there and public speak, which I know is scary. I don't want to do it either, but sometimes we have to. The next is applied relaxation. So the person's trained in PMR, which is progressive muscle relaxation, and then they're instructed to practice this during their daily activities to help confront the feared situation. The next is cognitive behavioral therapy, which is techniques focuses to change the thought pattern and physical reaction to social situations which induce anxiety. And both of these are typically accomplished with a combination of modeling, behavioral rehearsal, connected feedback, and positive reinforcement. Next is social skills training. It's exactly how it sounds. They take part in training that help better their social skills, and it actually seems to be really successful. And then there are safety behaviors. So like if somebody's giving a speech, to help them with their anxiety, they can like hold their hands behind their back or kind of shift back and forth, which helps them limit. But you want to make sure that you're not doing it too much to where the audience thinks that you're unconfident in yourself, but you can like still do it enough to make yourself feel safe. Another one is practicing what you're going to say before you say it. This could be if you're assigned to read a certain line in a book, you read it before it's your turn, so that way you have less of a chance of messing up in front of others. And then there's medication. You can take different dosages depending on your level of intensity. I know like for me, I have to take anxiety meds, and I take 2 different ones because one in the morning, one at night, because at night it's a lot stronger. And medication, it doesn't work for everybody, but there's a big improvement in it. So this is especially important for teenagers because people always say that their teenage years is like the time that they should be going out and living their lives and having all the fun. So social anxiety should not stop them from doing what they want to do and having as much fun as they can. After discussing what social anxiety is, some characteristics, and how it can be treated, I hope that if any of you have social anxiety, that it can lessen and you can live the best social life that you can. Remember that everybody has some sort of anxiety and that you are not alone. Thank you.